Hi, and welcome to Module 1, Assessment Types and Task Analysis. To complete your assignment successfully, you must be able to systematically analyze the task and what you will be assessed on. Now, this module will show you how you can do this. After you complete this module, you should be able to consider assessment types and their requirements, recognize key elements in a task description, analyze a task using a 6-step approach, and evaluate a marking rubric. Very important. Now, in health sciences, there are many ways that you are assessed. You still will have essays, you'll have reports to write, posters to make, reflections to write, videos to create, and many other forms of assessment. Before you begin any assignment, you really need to understand the task and you are very clear about what you need to do. The tasks may be written as a question or a set of instructions to follow, which you will need to carefully analyze. And along with those task instructions, you will have the marking rubric, which also needs to be very carefully examined. So to analyze a task and the rubric, you need to be able to identify the following. Obviously, the main subject of the task, the instructional words that are used to describe the task, what are the key aspects of this task, and the significant words that are used to describe the task. The questions that you can ask yourself that are relevant to the task. And what are the score values for each of the elements that you will see in the rubric? Now let's unpack this. So let's have a look at this 6-step approach in more detail. So first of all, the subject. What do? You ask yourself, what is this question overall? And you can highlight the main topics or areas of study, for example, climate change, nursing ethics. Instruction, look for the command words like discuss, analyze, compare, describe, evaluate. Now, each of these asks for a different type of answer, so be clear as to what you are going to be answering. Now, what are the key aspects? You need to find specific details or the limits. For example, what's the time period? Is it over the last 10 years, 5 years? Is it focused on one country, multiple countries, an area within a country? Is it focused on a group, elderly, for example, or a specific theory? Now, these will tell you what to include in your response, but equally what to leave out. Then you need to look at the significant words within the assignment description. And it's a good idea to underline those key terms to help you understand. So you may need to define something, you need to research something further. Maybe something like resilience, sustainability, cultural competence. Make sure that those significant words are clear in your mind. Now, it's always a good idea, having gone through those first 4 steps, to rephrase the question in your own words. Think about, what is the question really asking me what to do? And if you write it in your own words and compare it to the original, it should help you to understand clearly what the requirements are. Very importantly, you need to know what each element is going to be scored upon. So A clear understanding of the rubric is essential. That will tell you what you're going to be scored on. And having gone through those 6 steps, you can start to plan your response. So let's think about putting this 6-step approach into practice. And here we have an assignment. Let's have a look at this assignment. It asks, write 1,500 words on the following: quality healthcare provision in rural and regional Australia. And you have to choose a specific healthcare focus, for example, nursing, OT, pharmacy. And you've also got to choose a specific region or a state, Far North Queensland, or Far North WA, or Northern Territories. Include what is presently offered and discuss what the inhibitors are. Also include how technology may be able to support quality healthcare into the future. Okay, let's apply our 6-step approach. So, step 1. Subject. What is the main topic or area for this assignment? Well, quality healthcare provision in rural and regional Australia is the main idea. So you need to write how healthcare is delivered outside urban areas and what impacts the quality. And as I've used the word quality, that's what we're looking for. Quality of healthcare. How effective, safe, accessible. We also need to consider where. And in this case, we are looking at rural and regional Australia. So those locations that are outside the major metropolitan areas. Now we can start to think about where we may choose. So it may be nursing in remote Indigenous communities in the Northern Territories. Or it may be occupational therapy in rural aged care centres in Far North WA. Pharmacy or medication supply in outback Queensland. Step 2 is the instruction. What is the task asking me to do? Well, the words, right, 1,500 words. So this is going to be a formal essay. Discuss. Now, discuss means we need to explore, examine, and provide different viewpoints with reasoning and evidence. We are expected to provide information that is currently provided. Analysis, what the challenges and inhibitors are. Evaluation and prediction, how technology can improve care into the future. And the goal for this assignment is to present a balanced, evidence-based discussion, not just a description, and you need to support your ideas with credible references and citations. With step 3, we are looking at the key aspects. What parts or subtopics must be addressed? The question has multiple parts that we need to cover, and we need to break those down so we understand clearly what's required. Now, the required elements: quality healthcare provision. Where? Rural and regional Australia. Specific healthcare focus. What is presently offered? What are the inhibitors? And how will technology help into the future? So what does this mean? Well, quality healthcare, what makes care quality? We know safety, access, cultural appropriateness, workforce competence. Rural and regional Australia, well, we can choose where we would like to focus. Specific healthcare focus um, probably aligns to what you're intending to do professionally. What's offered presently, and what are the problems with what's being offered at the moment? What are the barriers and challenges? And then how will technology help into the future? And from those, you can start to make some notes. And those notes will help you to start to create and formulate your assignment. Step 4, what are the significant words that are used in the assignment description? So what terms or concepts need defining and or understanding? In our case, quality healthcare, safe, effective, person-centered, timely, equitable, efficient. We may need to use the SQHC framework. Rural and regional, what does that mean? And how many people are there? What's the population size? How remote is it? What are the inhibitors? What factors reduce effectiveness or access? For example, workforce shortages, infrastructure gaps, socioeconomic barriers. And what technological support is available? The digital or virtual tools to enhance care delivery. For example, telehealth, mobile health apps, and e-prescriptions. Step 5, we're going to rephrase the question. So let's have a look at our rephrase. In about 1,500 words, well, we have plus or minus 10%. Explore how quality healthcare is delivered in a specific rural or regional area of Australia within one health profession. And I need to explain what services currently exist, what prevents those services from being as effective as they could be, and how technology may improve the situation into the future. This allows us to think deeper. The question asks to analyze and evaluate, not just describe. It also expects to show a clear understanding of health systems within a particular profession. We need to clearly demonstrate our critical thinking in relation to perhaps barriers and inhibitors, and forward thinking, and that's in relation to the technology. Now, remember, we've got to narrow the scope, one region, one profession. We need to be aware of equity issues and access to care, major national priorities in Australia's health policy. So step 6, we have to analyse the rubric. What are we actually being scored on? It's very important that we know clearly what we're going to be scored upon. And this rubric identifies exactly what areas need to be presented and covered. So we need to analyse this very carefully. So this part of the rubric defines how our assignment needs to be structured and what needs to be included. It can see very clearly we need an introduction, current healthcare provision, inhibitors, present and future role of technology, and a conclusion, clearly defined as to what we need to provide. And this part of the rubric shows us what each section is worth when assessed. So we need to spend as much time as we can on the 3rd and 4th sections. So from those 6 steps, we can plan our response. So, the introduction, 150 to 200 words, current healthcare provision, around 400, inhibitors to quality care, also maybe around 400, role of technology and future directions, around 400, and we want a clear conclusion around 100 to 150 words. Now we're going to have a look at another type of assignment, and this one is asking us to create an engaging and informed 6 to 7 minute video presentation. In this case, the instructions are quite extensive. There's a lot to analyze. And I'll give you a minute or two to have a look through that. And here we have the narrated critique video rubric. And we can see that the rubric defines exactly what needs to be included in this presentation, in this video presentation. Also the marks. Now in this case, we've got inadequate, not competent, reaching competency, competent, and highly competent. Now it's always good to read through the extremes. So we read through what is inadequate, and then let's read through what highly competent is. That means that we know clearly how what we provide is going to be assessed and what the expectations are. And of course, we're working towards competent and highly competent. In the left-hand column, we have a clear description of what needs to be included. This also includes citations and references. So if we apply our 6-step approach to those documents, we can say, well, the subject is a video presentation. It needs to be creative. It needs to compare health provision in 2 countries. Now, one of those countries must be Australia. And the focus is funding, and funding in proportion of GDP. The instructions tell us it needs to be 6.5 minutes long. You as the presenter need to be a part of the presentation, and the video needs to show you speaking. Organization, how this is organized, needs to be very clear. And you can use a platform of your choice. Now, uploading this needs to be carefully considered and executed, and they are recommending that you practice. And remember, all the references need to be displayed on that final slide. So what are the key aspects of this presentation? Well, clear presentation, a focus on funding and funding models, and 2 healthcare performance measures, and those need to be the same for both of the countries that you choose. What are the significant words that are used? Well, research and analyze. Visual presentation. that needs a brief intro. We are comparing and contrasting the two countries, obviously. We need funding details aligned to two health performance measures. There also needs to be two healthcare challenges. And we need a conclusion and a summary. And we need to use APA 7. So let's question the question. In our words, compare and contrast healthcare funding models of Australia and another country, maybe Japan, using stats and performance indicators, and discuss two challenges. And we've already had a brief look at the rubric, but we need to analyse what that scoring is from inadequate to highly competent. So, when you next receive your assignment, remember to carefully analyse exactly what you are being asked to do and what you are going to be assessed on. And all the best of luck.